Outlet Syndrome, TOS. A 28-year-old female office worker presents with pain, numbness, and tingling in her right arm, particularly when she raises her arm above her head. She also reports that her hand sometimes feels weak, making it difficult to grip objects. On examination, there is weakness in intrinsic hand muscles, and her fourth and fifth fingers appear clawed at rest. When her arm is raised, her radial pulse weakens. Which of the following is the most likely cause of her symptoms? A. Carpal tunnel syndrome. B. Cervical radiculopathy. C. Thoracic outlet syndrome. D. Cubital tunnel syndrome. E. Radial nerve compression. Answer and explanation. C. Correct answer. C. Thoracic outlet syndrome, TOS. Thoracic outlet syndrome occurs due to compression of the lower trunk of the brachial plexus, C8-T1, and/or subclavian vessels in the thoracic outlet between the first rib and clavicle. Symptoms include neurologic, lower trunk compression, intrinsic hand muscle weakness, claw hand, plus sensory loss in medial hand forearm, vascular, subclavian artery compression, weak radial pulse when arm is raised, Adson's test pause and causes, cervical rib, extra rib, Pancoast tumor, lung apex tumor, repetitive overhead movements, e.g., swimming, baseball, weightlifting. Why not the others? A. Carpal tunnel syndrome, median nerve compression, affects thumb opposition but does not cause claw hand or vascular symptoms. B. Cervical radiculopathy, can cause nerve root symptoms but does not weaken the radial pulse. D. Cubital tunnel syndrome, ulnar nerve compression at the elbow, but does not involve the subclavian vessels. E. Radial nerve compression, causes wrist drop, not claw hand or vascular symptoms. Key USMLE takeaway: thoracic outlet syndrome equals lower trunk, C8-T1 compression plus weak radial pulse on arm elevation. Would you like a question on Pancoast tumor and its neurological effects?